Where are the scars for a lower facelift? So there are a lot of different ways to do a facelift and places to put facelift scars. And you should have a conversation with the physicians that you're consulting with about where they place them, because it makes a big difference. So in general, you want to have an incision in the temporal area here. If you're a guy, this can go straight up because you have a beard that whenever you lift, that moves up and that goes straight into the hairline, and that's no big deal. However, if you're a woman and this incision goes straight up, you're moving this little hair tuft here up, which can look kind of weird. And so you really want to avoid that. And you want to place the incision so you don't lose that hair tuft. So you're either moving this back, or you can place the incision at the bottom of this hair tuft so it's hidden in the hair itself and that hair does not move. Then you can come in front of the ear, this little cartilage here. In most people, I place the incision behind this cartilage, actually in the ear canal, so it hides in the crease between the earlobe and the cheek, actually up on the back of the ear itself, and then straight back in the hair. Some surgeons will place that incision at the hairline. Depending on how this is closed, you may or may not be able to see that incision. I go into the hair, that way you can wear your hair up in a ponytail or down or however you want to wear it, and you can't see the incision. Also ask to see pictures of surgeons' incisions because they can heal very different depending on how you close, what you use, the sutures you use, how you do it, and that person's particular healing. Can you see facelift scars? So ideally, you do not see facelift scars. They are hidden in the ear, in the hair, around the ear, even under the chin, so that you really can't see them. That is the idea, to be able to wear your hair any way that you want to wear it, do whatever it is you want to do, and not think about those scars. We have all seen the bad facelift scars that come down below the ear, and you know something has happened here. That is not the way that it should look. It should heal to where you can't even tell that it happened. How do you hide a facelift scar? So the placement of the scar is number one, and then how you close it is number two. So where I place my incisions is actually in the hair tuft here, and so it's hidden by the hair, and I create the incision so that the hair actually grows back through the incision, so you will see these little hairs through the incision, and you won't see hair and then line. Then I hide it around the ear, in the ear canal, up onto the back of the ear, and in the hair. So it's all hidden by hair and ear in some way. I also put a small incision underneath the chin. This hides great. No one really sees you from this angle, and many people have a little scar from bumping their chin as a child, and so it looks just like that. This, oftentimes, you can't see at all. I also use very, very tiny sutures and align the skin exactly perfectly, so it will just fade over time and you won't see that fine line. How long does it take to recover from a lower facelift? In general, it's about 2 weeks. We have you wear a dressing for that first night, a different dressing the second night, and then it looks like a little headband for about 2 weeks. So you have something going on for about 2 weeks. If you need to take this off for an hour for a meeting here or there, it's not a big deal, but you want to keep it on as much as possible to keep that skin up and tight the way we want it to be. Also, there's always a little bit of bruising and swelling. This is resolved or almost resolved at that 2-week mark. Usually at 2 weeks, other people can't tell that you've had anything done, but you will still notice changes in your face for about a month. So at a month, usually you feel fine, everything looks normal and looks really great, but you can go back to work and social functions, anything like that, about 2 weeks. But if you have something big like a wedding, or you're gonna see some family members that are very nosy and looking around, you might wanna give it 4 weeks just to be safe. Have questions, call or email anytime. I help people like you every day. Schedule a consultation on my website now. Thanks for watching.